So welcome, Chelsea.
Thank you.
We have your operation 2 days before.
That's right.
Yesterday we discharged you from the hospital.
Yes.
How was the recovery, or after operation? What did you feel? How difficult it is for you?
So
Tell me
far,
this.
yeah, the worst of it was probably waking up, and that was some discomfort that I'm used to.
Yeah.
About a half an hour after waking
Too
up.
much urge. Do you mean this? Too much urge to urinate.
Yes,
Yeah.
it was.
Constant feeling
Yes.
of there's some
Frequency.
pain and yeah.
Yes, and so then about after a half an hour, I felt much better.
Yeah.
For the rest of the day, I think with the pain meds and everything else, I felt totally fine. And then yesterday, after leaving the hospital,
We removed the catheter 1 day after.
yes.
I sometimes I see some bladders are too much inflamed, and if there is bleeding in the bladders, I want to put the catheter in for 2 days, and I can send the patient home hotel. I mean, with the catheter, or they may stay 1 day more in the hospital. They usually ask for it like €100, such a thing, or £100. But in your case, your bladder was in good capacity, there was no inflammation, so we take out the catheter at 10 o'clock in the morning. Your operation was at, I think, 2 or 3 afternoon. So before 24 hours, we removed your catheter. So what did you feel?
Honestly, I felt pretty great. I didn't feel a lot of symptoms.
Yeah.
I feel like when I went to go to the bathroom, there was some stinging.
Yeah.
But outside of that, I felt rather comfortable, and I'm trying to play it safe. Just drink water, bland food. And,
How much water did you drink yesterday?
Yesterday, probably a water
Two-
bottle full, and
You are not just used to say in kilograms, right?
Right.
You are like what do you use? Ounce? No, what pounds? You
oh
use?
yeah, ounces, yeah.
Okay, so at least 2 liters.
Yeah.
Between 2 or 4 liters, I recommend to drink water.
Okay.
This will cause a lot of peeing, going to toilet too much, but it doesn't matter. Your only job is to stay in the hotel, drink water, go to toilet. The
Okay.
first days will be like that. And I have to say, not all the patients are responding as well as you. There are some of them, like you maybe, but some of them, they have too much pain, too much irritation. And one of the ladies wasn't able to pass urine. We had to put the catheter in again. These are all possible, but really there are some people like you which are healing fastly. And I said to you after the procedure, you will heal fast. Your recovery will be easier.
Wow.
I hope so, but when I look into bladder, I can understand if it is too much inflamed or if it will respond better. So really, I am expecting a good recovery for you, but things may change. We give a lot of medications. If you have some infective attacks, we give some spare antibiotics boxes. And to prevent the possibility of infection, we give some phosphomycin-like drugs, and we give painkillers. You will have a long flight. When is your flight?
It's on Friday.
So today is Monday?
Yes.
Monday. So if you had to plan again and you are in this condition, which is the earliest time you can fly? How do you think?
I would be able to, probably fly tomorrow if I needed to.
Yeah.
It's nice to have an extra few days, but
Yeah. And do you think you can go some sightseeing in Istanbul?
Oh,
How do
yeah.
you yes.
Oh yeah.
Everybody must not accept this or expect like you, but yeah, there are some. I think you can go some sightseeing. And yes, they asked me how long we have to stay after the procedure. So it is your first day after the procedure. No, this is
the first day after leaving the hospital.
leaving the hospital, and maybe tomorrow you could go to be in safe. Maybe the next day. Not Tuesday, but Wednesday would be better. But you reserved till Friday. This is good. At third week, things may change. Bladder tissues will shed and you may have bleedings, you may have irritation, some problems, but we all manage this with WhatsApp messages, video talks. We can manage it. We are managing it, and we will ask for some cultures, urine cultures in the future. So this is a long period. Previously I was saying 6 weeks will be enough, but now I am saying 3 months may be needed. In near future we will see which is the best recovery time, or what percentage of people recovers in 6 weeks, what percentage in 3 months, what percentage is longer. So yeah, thank you. You're from very long way, from New York, right?
It was worth it. It was worth it. I mean, looking at your videos, I know that you pay attention to all the different places that the tissues could possibly be.
Yeah.
And so that meant a lot to me that you were taking everything into account and you talk about it as you do it. And so I learned a lot, and
I am learning a lot.
Yeah.
This is all experiences happening like this. You see one patient and learn something and apply it to the other. So I was doing the procedure very differently, very superficial related to what I'm doing now. So we are, what can I say 100% is we are a big family now. I am sure 100%. I talked to maybe more than 200 ladies in this situation. So I guarantee that I told them. So, and everybody is having some different response to treatment, and their symptoms are different. So we are collecting the data, and we are in connection, very good and high level connection. So we are fighting with this disease. We will find the best solutions. I can promise that 100%. But we will see the results in near future very clearly. I wish the best for everyone. So we will see.
Thank you.
Come, we will look with ultrasound.
Okay, sounds great.
Now we are looking in the bladder. It's a quite half filled, and the treated part is this part. Now it is thinner than the surroundings because its fulgurated part is that. So you can fill your bladder nicely. This is good. And the rest of the bladder thickness is normal. So it's not a deep resection, deep fulguration. It seems normal, great. We will follow up.